My name is Peter Forsberg. I'm an assistant professor at the University of Colorado and a specialist in myeloma and other plasma cell diseases. So what does it mean to have multiple myeloma and how is this disease diagnosed? So multiple myeloma is a type of blood cancer. It comes from a cell called a plasma cell. Any type of cancer comes from a normal cell, but that cell has changed. You have an original cell that is shifted in some way, usually with genetic changes, sometimes changes in the environment around the cell, that then leads to those cells growing out of control, and sometimes to causing downstream consequences as they grow and expand and live longer than they should. So multiple myeloma stems from the plasma cell, which is an immune cell. When they are normal cells, they're part of your lymphoid system. They are fully developed B cells, so they have some similar properties to some other lymphoid cells that may give rise to diseases like lymphoma when they develop into malignancies. But plasma cells are a little bit unique, and the issues that they cause are somewhat unique, and those give rise to some of the things that myeloma may manifest as. So multiple myeloma is a type of cancer caused by plasma cells. When plasma cells are functional and doing their job, they live in your bone marrow primarily, and they're antibody-producing cells. So they create antibodies to help prevent a variety of different types of infections. When plasma cells begin to behave abnormally and grow as they do in multiple myeloma, that often leaves us with the production of an abnormal protein that can be a really important part of the how is myeloma diagnosed question. So myeloma is often diagnosed when there are any of a number of issues that may be caused by myeloma that give suspicion for it. So the most common manifestations or problems caused by myeloma are what we call our CRAB manifestations. So that's C is for calcium or high calcium level, R is for renal or kidney problems, A is for anemia, which is a low red blood cell level, and B is for bone problems. And the most common bone problems caused by multiple myeloma are what we call lytic bone changes or erosive lesions in the bone. So multiple myeloma is often diagnosed when there is some suspicion for it based on the presence of one of those CRAB manifestations. There can be other potential indicators like a high protein level in the blood. Sometimes people who have problems with their nerves or recurrent infections may also be evaluated. When there's suspicion for myeloma, the tests we use to help identify it include tests of blood, sometimes urine, imaging to look for those bone changes, and then often a biopsy, usually of the bone marrow, occasionally of a more focused or concerning lesion. When we look for myeloma, we use blood tests to look for abnormal antibodies. I mentioned plasma cells are antibody-producing cells, so when there's concern for multiple myeloma, we'll do a few different blood tests that help to look for the presence of abnormal antibodies. The main one of these is called the serum protein electrophoresis, or SPEP, SPEP. This is often done in conjunction with what's called an immunofixation electrophoresis, and essentially these are tests that look for the presence and to look to quantify how much of an abnormal antibody may be present, and that may be a sign of something like multiple myeloma. We also will often check total antibody levels called quantitative immunoglobulins, looking at serum-free light chains in the blood. We may do a lot of these tests as well on the urine to look for the presence and quantify the presence of abnormal proteins in the urine. Almost all patients with multiple myeloma have a detectable and quantifiable abnormal protein in the blood, although the type of protein we find and how we might monitor their disease over time can be different patient to patient. Once we've identified and evaluated for those abnormal proteins, we'll often do other tests to look for kidney function, calcium level, blood counts, including anemia or hemoglobin level. And then we often do a more thorough skeletal imaging to look for the presence of any bone imaging, and that could include CAT scan, PET scan, or MRI. There's different treatment approaches that all have sort of various benefits to them potentially. Once we identify the risk for myeloma or suspicion, then a bone marrow biopsy or another biopsy will help us to see if we do identify those abnormal plasma cells And beyond identifying them, it may give us important information about some of the genetic features that underlie the myeloma that may lead to a better understanding for how aggressive the myeloma may behave over time. So it's an important part of our evaluation as well.